Why burnout is the big mental health burden. Everybody has experienced the Monday morning feeling that the weekend wasn't quite long enough to recover from the previous workweek's exhaustion. The World Health Organization, WHO, reports that anxiety and depression reports increased dramatically by 25% around the world in the first year of the COVID-19 pandemic. However, one of the biggest problems with mental health that emerged during the lockdown and is still a big problem is burnout. Burnout is a type of exhaustion brought on by a constant sense of being swamped or overloaded. It results from ongoing emotional, physical, and mental stress, which can have a significant negative impact on your body and mind. Feeling disengaged with your work or job, coupled with irritability and acting out of character, can be one of the first signs of burnout. Additionally, you might find it challenging to prioritize or make decisions. The crippling physical exhaustion is not another issue that sleeps nor does rest seem to be able to cure. In fact, burnout can be a double-edged sword because sleep problems, another common symptom, inevitably make any feelings of mental and physical exhaustion worse. Working from home during lockdown accelerated the development of an always-on work environment where managers frequently expect their teams to produce more work, and online presenteeism is rampant. According to data by NordVPN teams, employees in nations like the UK, Canada, and the US report that the amount of time they spend logged on at their computer has increased by more than 2 hours per day since the pandemic. Sadly, these problems have not been resolved since the lockdown ended. People still feel unable to let up on the gas, even when they are completely out of fuel due to the unreasonable nature of their workloads and the added stress of the ongoing global economic crisis and impending recessions. Who is feeling the burn? Burnout does not discriminate, like all mental health conditions, though research indicates that some groups may be more vulnerable than others. For instance, a Future Forum study of more than 10,700 workers in 6 nations found that women are 32% more likely than men to experience burnout. On the other hand, younger workers are more susceptible to burnout. The likelihood of symptoms is 29% higher in people under 30 than it is in people over 30. Middle managers are bearing the brunt of workplace seniority and have the highest rate of burnout, 43%, compared to all other job levels. Recovery from burnout requires an understanding of stress and effective stress management. When used alone, medication can be helpful, but it doesn't address the underlying cause of burnout. Knowing your threshold can be useful because resilience varies from person to person. New testing techniques can shed light on each of our personal stress thresholds. Effective treatment strategies must address both physical and mental aspects of stress because it can be just as taxing on the body as it is on the mind. In order to address the root causes of mental health problems and burnout, mindful practices like meditation and yoga should be at the center of treatment plans, as evidenced by an expanding body of research that ranges from anecdotal accounts to independent peer-reviewed studies. This strategy has been shown to be successful, and it also gives people tools they can use whenever and wherever they are. Untreated burnout can become a serious problem that affects every aspect of a person's life. Performance, productivity, and interpersonal relationships may all be impacted. Stress and substance and alcohol abuse are strongly correlated, and people who don't receive adequate treatment are more likely to turn to drugs or alcohol as a coping mechanism. Addressing burnout has a clear collective benefit in these uncertain economic times. Burnout has wider costs in addition to its personal effects on the person who is experiencing it. In the UK, mental health issues cost the economy at least £117.9 billion annually, according to a report by the Mental Health Foundation and the London School of Economics and Political Science, LSE. Naturally, prevention is always preferable to treatment, and a significant change is required in employee expectations as well as global workplace cultures. However, revolutions do not occur quickly. It will take time, but we are making progress toward a better work-life balance that reduces the risk of burnout at its source. to improve their chances of recovery and give them the knowledge and skills to manage stress as they move forward with their lives, we can change the way we support those who are going through it right now.